Good day, everyone. For today's topic, we will be discussing the third tissue processing step, that is clearing. But before that, let's have a brief recap regarding the other tissue processing steps. We have fixation, so this one class is the first and most critical step in the histotechnology, which involves the preservation of fresh tissue for examination. What does grossing mean again? This is the cutting of tissue specimens ready now for examination. Don't be confused, class, if fixation comes first before grossing in this diagram. Because sometimes in the histopath laboratory class, especially if the specimens are sent at around wee hours of the night, the neutral buffered formalin, which is the fixative agent, should be added to the container together with the tissue specimen. When the histotechnologist is back later that morning, grossing is then done. But when there are also instances that the histotechnologists are available, there are no other specimens that is needed to be processed, then grossing comes first before fixation and then placed into the autotechnicon for processing. Next is decalcification. So this one class is optional. This is for tissues that contains calcium. So this comes after fixation or before impregnation. Certain specimens like bones, teeth, and other calcified tissues like the tuberculous lungs, these are the appropriate specimen for decalcification so that there will be accurate evaluation and examination of this histologic section. So again, what is decalcification? This is the procedure whereby calcium or lime salts are removed from the tissues following fixation. Decalcification also class prevent obscuring the microanatomic detail of the sections such as the bone dust and other cellular debris. Inadequate decalcification may result in what? Poor cutting of hard tissues, and there will be damage to the knife during cutting. So your microtome will be damaged, and then remember that the microtome is very expensive. Next is dehydration. So remember that dehydration is the process of removing intercellular and extracellular water from the tissue following fixation and before wax impregnation. So I think that's enough for our brief recap. Let's proceed to clearing. Clearing, or otherwise known as de-alcoholization, so meaning de-alcoholization, to remove alcohol. Remove alcohol. So this is the process whereby alcohol or any dehydrating agent class is removed from the tissue and replaced with a substance that will dissolve the wax with which the tissue is to be impregnated or the medium on which the tissue is to be mounted. When the dehydrating agent has been entirely replaced by the solvent, the tissue has a translucent appearance, hence the use of the term clearing agent. Few dehydrating agents are miscible with paraffin wax. When used after alcohol dehydration, the clearing agent serves to mix with alcohol and removes it from the tissue. It should be miscible also with paraffin in order to facilitate the penetration of this embedding medium. The most commonly used clearing agents for de-alcoholization in the embedding process are xylene, dioxane, chloroform, and cedarwood oil. When used after the tissue section has been stained, the clearing agent will make microscopic tissue preparations transparent due to their high index of refraction. What does high index of refraction mean? Kindly write this down. An index of refraction means that This one is the measure of the bending of the ray of light that passes through one medium going to another medium. Aside from removing alcohol, a clearing agent must also be miscible with Canada balsam and other resins that are used for mounting the sections. Glycerine and gum syrup. These are used when the tissue is to be cleared directly from water, like in a frozen section. No de-alcoholization is involved in this process. The clearing agents merely improve the refractive index of the tissue. Because of the high refractive indices of most reagents used for dealcoholization, tissues, particularly embryos and parasites, become transparent so that the internal structures become visible to the naked eye. This is due to the property of making tissues transparent. Solutions utilized for alcohol removal are also called clearing agents. But not all clearing agents, however, exhibit this property. So, this gives us the ultimate question as to what are the characteristics of a good clearing agent. Number one, it should be miscible with alcohol to promote rapid removal of the dehydrating agent from the tissue. It should also be miscible with and easily removed by melted paraffin and or by mounting medium to facilitate impregnation and mounting of sections like Canada balsam. It should not produce excessive shrinkage, hardening, or damage of tissue. Not evaporate quickly in a water bath. It should not also dissolve out aniline dyes. And of course, it should make tissues transparent. Most clearing agents are flammable liquids that warrant considerable caution in their use, and the histotechnologist should be aware of the large quantities used in routine processing. This is done so that the safest method of use and storage can be adopted. Clearing fluids with a low boiling point are generally more readily replaced by melted paraffin, although chloroform, which has a lower boiling point than xylene, in fact takes longer than the latter to clear. Viscosity also affects the speed of penetration of the clearing agent. Prolonged exposure to most clearing agents causes the tissue to become brittle and therefore more difficult to cut. Among the common clearing agents used are we have xylene, or commercially known as xylol. This is a colorless clearing agent that is most commonly used in histology laboratories. Clearing time is usually half to 1 hour and is used for clearing, both for embedding and mounting procedures. It is generally suitable for most routine histologic processing schedules of less than 24 hours and when the tissue block size is less than 5 millimeters in thickness. The advantages of using xylene is that it is the most rapid clearing agent, which is suitable for urgent biopsies, which it clears within 15 to 30 minutes. This one is miscible with absolute alcohol and paraffin and does not extract out aniline dyes. For mounting procedures class, it does not dissolve celloidine and can therefore be used for celloidine sections. It evaporates quickly in paraffin oven and can therefore be readily replaced by wax during impregnation and embedding. And of course, this one is very affordable. The disadvantages of using xylene is that if you use this longer than 3 hours class, 3 hours, it makes tissues excessively hard and brittle. It causes considerable hardening and shrinkage of tissues, hence is not suitable for nervous and lymph nodes. Xylene also becomes milky when an incompletely dehydrated tissue is immersed in it. Next is toluene. This may be used as a substitute for xylene or benzene for clearing both during embedding and mounting processes. Time recommended for clearing using toluene class is 1 to 2 hours. Some of the advantages in using toluene class is that it acts fairly rapidly and is recommended for routine purposes. Tissues do not become excessively hard and brittle even if left in toluene for 24 hours, and this one is not carcinogenic. However, it is relatively slower than xylene and benzene and tends to acidify in a partially filled vessel. This will also emit fumes that are toxic upon prolonged exposure and is more expensive than that of xylene. Next is an excellent clearing agent but is very hazardous. Benzene is preferred by some as clearing agent in the embedding process of tissues because it penetrates and clears tissues rapidly. It is rapid acting, hence is recommended for urgent biopsies because it can clear within 15 to 60 minutes and also for routine purposes. It volatilizes rapidly in paraffin oven and is therefore easily eliminated from the tissue. Benzene does not make tissues hard and brittle, and it causes minimum shrinkage. But the disadvantages in using benzene is that aside from it is highly inflammable, if a section is left in benzene for a long time, there is considerable tissue shrinkage that may be observed. Hence, tissues should be transferred to paraffin wax as soon as possible. Excessive exposure to benzene may be extremely toxic as well to man and may become carcinogenic. This may also damage the bone marrow, resulting in aplastic anemia and also causes acute myeloid leukemia. If ever benzene is to be used for clearing, the laboratory should be well ventilated. This next clearing agent is termed as a not true clearing agent. When using chloroform for clearing of tissues during the embedding process, this one has a slower action compared to xylene but causes less brittleness. Thicker tissue blocks, even those up to 1 centimeter in thickness, can be processed. However, tissues placed in chloroform do not become translucent, hence the term not true clearing agent. The advantages in using chloroform is that it can be recommended for routine work since it clears tissues for 6 to 24 hours. And this is also recommended for tough tissues such as the skin, fibroid, and decalcified tissues. You can also use this for nervous tissues, lymph nodes, and embryos because it causes minimum shrinkage and hardening of these tissues. As what I have said a while ago, this one is suitable for large tissue specimens and this is not flammable. The disadvantages in using chloroform overpowers its advantages class because this is relatively toxic to the liver after prolonged inhalation and may be prevented by adequate room ventilation and proper caution when handling the specimen. Wax impregnation after chloroform clearing is relatively slow. It is not very volatile in paraffin oven, hence is difficult to remove from paraffin sections. It may even produce considerable deterioration of the wax. Its vapor may attack the rubber seal used in vacuum impregnating bath, and complete clearing is difficult to evaluate. Tissues also tend to float in chloroform, but this may be avoided by wrapping the tissues with absorbent cotton gauze to facilitate sinking of the section in solution. But this technique class is very tedious and it will cost you so much time. So as much as possible, never ever use chloroform. This will also evaporate quickly from a water bath. The cedarwood oil class is used to clear both paraffin and celloidine sections during the embedding process. It is specially recommended for central nervous system tissues and cytological studies, particularly of smooth muscles and skin. It requires two changes in clearing solution, and clearing usually takes about 2 to 3 days. These are some of the advantages in using cedarwood oil as a clearing agent. It is very penetrating and is miscible with 96% alcohol, which it removes readily. It clears celloidine in 5 to 6 days, causes minimal shrinkage and hardening of the tissues. Tissues may be left in oil indefinitely without considerable damage and distortion. It does not dissolve out aniline dyes, and clearing with cedarwood oil often improves cutting of the sections. But remember, class, oils are not commonly used as a clearing agent in the histopath laboratory. The following are the disadvantages in using cedarwood oil. It is extremely slow clearing agent, hence is not recommended for routine purposes. It is hard to be eliminated from the tissues in paraffin bath, making the wax impregnation process very slow. This may be improved or hastened by transferring the specimen from oil to benzene for half an hour before finally placing the tissue in wax. Quality is not always uniform and good in using cedarwood oil class. So tissues cleared in cedarwood oil initially float before gradually staying to the bottom as clearing proceeds. Hence, the tissue may dry out before it is completely cleared. This can be prevented by superimposing absolute alcohol on the surface of the clearing agent. Once saturated, the specimen should then be transferred to a fresh solution of cedarwood oil. This clearing agent also becomes milky upon prolonged storage and should be filtered before use. Cedarwood oil that has been previously used to clear acetic alcohol fixed tissues may produce crystals with a melting point of approximately 35 degrees Celsius and therefore interfere with adequate clearing of tissue. The solution must be heated to 200 degrees Celsius in order to dissolve the crystals and restore the solution to its normal state. This cedarwood oil class is also very expensive. Aniline oil is not normally utilized as a routine clearing agent, but is rather recommended for clearing embryos, insects, and very delicate specimens due to its ability to clear 70% alcohol without excessive tissue shrinkage and hardening. On the other hand, clove oil is a reagent which causes minimum shrinkage of tissues. However, its quality is not guaranteed due to its tendency to become adulterated. Wax impregnation after clearing with clove oil is slow and difficult. Tissues become brittle, aniline dyes are removed, and celloidine is dissolved. All of this, in addition to the expensiveness of the solution, make it unsuitable for routine clearing purposes. Carbon tetrachloride may be used in clearing and for embedding. Its properties are very similar to that of chloroform, although it is relatively cheaper. Its disadvantage is the same as that of chloroform, which provides considerable tissue hardening and is dangerous to inhale on prolonged exposure due to its highly toxic effects. The last two will be methyl benzoate and methyl salicylate. These are slow-acting clearing agents that can be used when double embedding techniques are required. That is it for the third tissue processing step, clearing. For questions, I will be making another poll in our Histopath FB page so that you can comment down any of your questions and inquiries. Thank you so much for listening, and God bless us all.